Welcome to Doctors on Call. I'm Jenna Miller. More than 60% of American households own a pet, which makes it no secret that veterinarians are in high demand. Investing in an experienced vet is a must for the overall health and safety of your furry family member. Keeping your pet healthy takes some effort, whether it's plenty of exercise or proper diet. Tonight we'll be discussing that and what else needs to be done to ensure your pet gets the best life they deserve. You may want to gather up your fur babies and join Dr. Steve Mosier and Dr. Matt Nichols for this week's Doctors on Call featuring pet health as our topic.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Pet health is our topic this evening on Doctors on Call. Please take this opportunity and call 800-337-4788 with your questions. Dr. Steve Mosier completed his Doctor of Veterinary Medicine at the Kansas State University College of Veterinary Medicine in Manhattan. Dr. Mosier worked in Wichita and Nebraska before joining the Army Veterinary Corps. He then joined Hayes Veterinary Hospital in 1970 and became full owner in 1995. Dr. Mosier is a member of the American Veterinary Medical Association and the Kansas Veterinary Medical Association and was named Veterinarian of the Year in Kansas in 2000. Dr. Matt Nichols, DVM, is the owner and veterinary practitioner at Town and Country Animal Hospital in Russell. Dr. Nichols is a 1986 graduate of Russell High School. He holds degrees from Kansas State University, a Bachelor of Science and his doctorate in veterinary medicine, as well as a Master of Science from Oklahoma State University and a Master's in Business Administration, also from Oklahoma State. Dr. Nichols' veterinary practice is a combination of companion animal and food animal. Matt believes strongly in practicing preventative medicine. One of his primary interests is small animal dentistry, as poor dental health quickly can lead to poor systematic health. Give us a call at 1-800-337-4788 toll free with your questions about your pets on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. Let's go ahead and get started with some of our questions here while we wait for those calls to come in. First of all, many animals get pretty nervous when they come to the vet. Is there anything a pet owner can do to try to ease that or to prepare them for those visits?
Go ahead.
Well, I think taking frequent trips to the facility, not necessarily going in, but getting the animal used to taking rides, number one, would be the thing. And if you get really desperate anymore, they've come out with a new drug called trazodone in the last couple of years that is an anti-anxiety drug, and so a lot of people will use that. I think if you don't have to, I think it's better not to. However, that is there. So that would be the thought I would have.
I agree. I think the other thing we try to get our owners to do, with their pets, and start when you're young. Obviously, if your pet's 5 or 6 has anxiety issues, you still have to address that. But, like Steve said, frequent trips. We try to get our owners to bring their pets in, just weigh their dog. We don't charge to use the scales. Obesity is a problem we have with dogs anyway. Bring it in, weigh the dog. We'll give it a treat. We might be aiding the obesity a little bit, but we'll give the dog a treat. Their experience is good. There's no shots. There's no handling for the most part. No pressure on the animal. We tell people to do that all the time. And so I think exactly, it's more of a conditioning thing than anything. So the more you can expose them to any type of a stimuli that they're going to see, but especially in a clinic setting, our vet clinics they smell different, a lot of animals. So it's important to get them in there and teach them that not everything has to be a high anxiety moment.
Okay, we're going to go to the phone lines. We've got a caller, John, waiting to ask a question. Hi, John. This is John from Hayes. Go ahead with your question for our doctors tonight.
Okay, I have a German Shorthair hunting dog that is about 10 years old, and he has a growth, it appears, on the tip of his tongue that's maybe about the size of a dime or a penny. And I was wondering what the best course of action is besides having him examined.
I guess I'll answer that best, and I don't mean to offend anybody, but I tell my owners all the time I'm not very good and I don't diagnose from pictures. So it gets pretty tough. Remember, human doctors would not diagnose somebody with something like that. So we're trying to diagnose animals that can't talk to us with the same type of problems. To be quite honest, I guess my opinion would be if it doesn't bother him and you don't want to do a vet visit, I guess you just watch it. If it grows rapidly, it starts to bleed or something like that, then I think you need to be seen. But if I tell people all the time, if you're really concerned, the best thing we can do is take a look, and your veterinarian can determine from there, does it need to be biopsied, does it need to be removed, is it okay just to monitor it? It's hard to tell without actually seeing it though.
Now, how frequently would you biopsy something and it turns out cancerous or something very serious?
I think more than a lot of people will realize that we will see that. And we usually give our clients the option to send that in and to have it biopsied. And that adds about $100 to the bill, and they need to be aware of that. By the same token, we can, I think, grossly look at it and pretty much say, I think you really ought to send this in, or this is a lipoma and we think it's probably okay. So we can give some guidance in that. Some people think we ought to send in all of the tissues. I'm not a fan of that yet, but we will give them the guidance and what we think we ought to send in.
Okay, I believe we have another caller on the line waiting to ask a question. Go ahead with your question for our doctors.
What made you decide to become a veterinarian?
For me, I think you have to combine. Everybody wants to, the thing I get when I talk to young people who are in vet school or are thinking of going is a lot of them want to work with animals. They like puppies, they like kittens. A lot of people say, I don't want to work with people. Without the people, our patients don't get to the clinic. And our patients don't have a checkbook. So, we have to work with the owners to, so you have to have some people-oriented skills. But for me, I did like animals. I really enjoy the science behind things. Trying to figure things out, it can be stressful, but some of these medical problems you really have to delve into and look at and use a lot of different diagnostic tools, which I find interesting, and it's challenging. So combination of liking animals, talking to people, and then trying to help them out and being able to solve that puzzle is what I like about it.
Yeah, I think you like the feeling of making a difference, and once in a while we get a chance to make a good difference. If we see a sick animal or some surgery goes the right way. For me, I come from a family that I have 4 other veterinarians that are brothers that are veterinarians. So I thought, well, if it's good enough for them, it ought to be good enough for me, so here I am.
Steve had no choice.
Well, and you guys have a tough job because you're dealing with owners or humans, their best family members, let's face it. Okay, we're going to go back to the phones now. We've got Charles on the line from Ellis County. Hi, Charles. Go ahead with your question for Dr. Mosier and Dr. Nichols.
Yeah, I've got I'm not sure on the age, probably getting close to 5. I got him at the Humane Society. He's a German Shorthair, and I've just noticed that he's got like a cyst type thing starting on his back leg, and it's about the size of a $50, and it's perfectly round, and you can push on it, and it'll move, but it moves in all at one time. It's like a little sack thing. I was just wondering what you think about that.
Well, I think obviously the best thing to do would be take a look, and then we can really tell you what it is. From what you've said, it's movable, and if it involves the skin only, to me that's a good sign. We're talking about cyst, maybe something like that, but again, I can't say for sure unless you look at it.
Yeah.
Okay, we're back to the phones. We've got Jackie on the line from Plainville. Hi, Jackie. Go ahead with your question.
Yes, our neighbor's dogs had to have all their teeth removed because they were so rotten. I don't think my dog. So any advice how to clean my dog's teeth?
kind of cut in and out. It sounded like you're asking for advice on how to clean and keep your dog's dental health in good shape. I think there's several things. Partially it depends on the condition of them right now. If they've got a lot of tartar, if they've got any loose teeth, if there's any present dental disease, to do a good job at home, you really need to have them professionally cleaned, probably, and addressed. Now, given a 5-year-old dog, I think that was the question, or the age, but if the teeth aren't too bad yet, daily brushing is one of the best things you can do. You need to use a pet toothpaste. Human toothpaste and the fluoride causes some problems. There are enzymatic toothpastes that are flavored that are really good, and most dogs like to have their teeth brushed once they're trained to it. There are chew toys, but chew treats that are available that have been specially designed to clean teeth. The design and the material they're made out of. You can look on the bag and see if they are endorsed by, what is it, the VOHC? Is that the Veterinary Oral Health?
Sounds good to me.
But you can look and see if they're endorsed by a veterinarian dental type of an organization. I think those are really good. So there are things you can do at home. Like I say, if the tartar's too severe, brushing and things like that are not going to do much until you have them ultrasonically scaled, which we would do at a veterinary clinic. But those are the things I would start with.
What kind of brush do you use? A human toothbrush? I know not human toothpaste, but can you use a human toothbrush?
I think you can. They do make ones for dogs, but I think the brush is okay. And I agree with Matt that you ought to use a toothpaste that's designed for the dog. And I think the key, even though here we're too late, you start when they're puppies. It's just like anything else. You train them when they're young, and then they don't mind you brushing those teeth.
Okay, we're back to the phone lines. We've got Beatrice on the line from Scott City. Go ahead with your question.
Yes, is this for the animals or for humans?
Tonight's show is for animals.
Okay.
Do you have a question about your pet?
Yeah, I have a question about I have she's 16 years old, female puppy, and, well, she's not a puppy anymore, she's, but we had her inside the house, and then we got another Chihuahua, and she wasn't doing good potty trained, but my Sassy, so I kind of let them stay in the garage, but my Sassy's 16 years old. Is her joints not good? I haven't taken her to a vet or anything, but she gets her shots all the time, and I don't know. What do you think?
Her joints, I think she's...
I guess 16 years old would be considered a very geriatric dog, just like a geriatric person. I certainly know that as I've gotten older, my knees, my back hurt. So yeah, I'm sure there is some degree of what we call degenerative joint disease, or just what is arthritis. And the cold probably exacerbates it a little bit. How much really depends on the dog, depends on the condition of your garage and the heat and temperature. One of the things that, just in general for older dogs, I've become a big believer in is some glucosamine supplements. We've got some products we like, I'm sure Steve does too, but I think they make a huge difference in a lot of our pets. So maybe doesn't answer this lady's question totally, but I do think anybody with geriatric pets or pets entering what I'd call the middle-aged years of 5 to 7 or 8, I do think you need to visit with your veterinarian about getting that dog or what type of glucosamine joint supplements they might recommend.
You bet. I think so. I think those supplements do a tremendous job. And then I think if you get into a real bind and you want to do something at home, we can use aspirin in dogs as an anti-inflammatory, and you'd want to check in on the dosage and the side effects and everything like that. But I agree with the supplement thing. If you get started early enough, that'll make a lot of difference.
I agree, and I'll just throw this out. Pain medication in cats, never use Tylenol. Their kidneys cannot handle it, and it will actually cause their death. In dogs, you do not want to use ibuprofen. A lot of cases of perforating stomach ulcers from the use of ibuprofen. Aspirin we get along with okay, but don't take that, and you really need to check with your veterinarian even on an aspirin dosage. But just try to stay away from the ibuprofen on your dog.
Now, she had a 16-year-old dog. Is it okay to go ahead and start that dog on glucosamine? Is it ever too late, I guess, if you will?
I don't think that I've ever read where glucosamine supplement used properly is a problem.
Nor I. Yeah, I agree. Yeah.
Great advice. Okay, let's talk about microchipping your pet. How important is that?
I think it depends on your philosophy. I think there's some limitations to microchipping. If you microchip, it's a perfect identification, permanent identification. And if you find somebody that says, this is my dog, no, the other person, oh, this is my dog. If you got a microchip in there and you know it, you can go have that thing scanned. The downfall, the only downfall, is that you have to have it scanned. If we have a dog come in that is found, we'll automatically scan every dog to see if there is a chip. So if we find that, then we can follow that back, and in that way, it's a wonderful thing. I also think if you travel a lot, it's a really good idea to have a microchip, because if they get away from you, then you at least have a chance to get that pet back.
How does the procedure work to get that microchip in?
It's really simple, and I agree with Steve. And I look at it, I do a lot of hunting, have hunting dogs, have friends with hunting dogs. I just can't imagine having the investment in training a dog, working with the dog, and then not wanting to chip that dog, for example. And it is the best way to get your pet home if they're ever lost, slip out the door and run around or something. So I think it's important. The procedure is very simple. It's about like getting a shot, your dog getting a shot. They come pre-packaged, they're sterilized. We open the package, insert the needle, then I scan them to make sure that the chip is working, and that's it. It probably takes, from the time they hit the exam room, unless they're a dog that we have to restrain with a couple people, but most dogs, if they take a shot well, will take it. Cats too. 30 seconds to a minute is all it takes. So it's well worth it. And like Steve said, it's permanent, one time in their life, and we do a lot of them when we spay or neuter them. They're asleep. They never even know it's been done. I think that's a great time to do them. So.
All right, great. We've got another caller waiting to ask a question. This one is from Salina. Go ahead with your question for our vets tonight.
Yeah, well, so I have a chicken and it's white. We have a lot of white chickens, and so I got a white chick, and it grew up with the other chicks, and I was just wondering how to recognize it, my chicken.
That's yours.
Oh, I don't know.
Is there identification for chickens that you know about?
I would look into getting some sort of a leg band. Mm-hmm. They make leg bands for, I guess, migratory birds, but also for other birds. I really don't know how to get one, but I think your veterinarian could probably figure it out, or, excuse me, you may even be able to find it online, but I think that would be about as simple as anything would be a leg band.
I think so.
Should be safe, should not cause any health problems. I think that would be a good idea.
Okay, we're going to take another call. This is Kristen from Hayes. Go ahead with your question for our vets tonight.
Hi, we recently had our dog with the groomer use, I believe they called it CBD oil, to sedate and calm the dog for grooming. And we were just wondering, is that safe? Is that something that if we were to groom them at home that could be used? Have you ever heard of that?
There's a lot of people, I think, trying that method. I think as veterinarians, legally, we cannot get into that yet because it's against the law. We have clients come in and says, do you think I can try that? And I say, sure, go ahead and try it. I don't think it's going to harm anything. I'm not for sure how much good it's going to do, but I don't have any objection to them going ahead and saying, if it works, we'll fine and dandy,
Yep. Yeah, I'm the same way. I think there's still a lot of research out there. I don't know if there's, I don't know how much good research there is that it does or does not work. And I feel like if you're using it for whatever the situation is and you think you get a response, I don't have a problem with it. How much is too much? I guess that part I don't know. So, but I think you just have to try it and see.
Okay, just don't try it on yourself, right?
Okay. Ask your human dog.
We're going back to the phones. We've got Dee on the line from Wichita. Hi, Dee. Go ahead with your question for our veterinarians tonight.
Okay, so I have a 6-year-old rough collie, and I have had issues with him having ear infections. The veterinarian prescribed antibiotics. I put him on a regimen of antibiotics, and I also put the stuff they prescribed for his ears in his ears, and it just keeps coming back and keeps coming back. Got any advice?
Well, I think that we do see chronic reoccurring otitis in some dogs, and it is a real problem. And probably if you haven't, that probably ought to be cultured and see if we can nail down the bug that's really causing the problem. And then the literature is out there on grain-free foods that may help with otitis. Now, I'm not for sure that I'm a real believer in that. However, I have had some clients that said, I have changed to grain-free diet, and it has helped with ear infections. So those would be the two thoughts I would have.
The first thing is you're finding it out, and if you're veterinarian, I'm sure they told you. If not, they will. It can be really frustrating. And believe me, it's frustrating for the veterinarian as well. We want to solve things. And sometimes these medical conditions are very difficult to solve. Ear infections, to me, are one of them. Mm-hmm. I think they can be ones that you look at them and give them a medicine and it really doesn't matter. It's like fairy dust, it goes away. There are others that no matter what fairy dust we use, they continue. I will vouch that I had one that recently that we cultured. We had to go to what's called a compounding pharmacy because there was not a commercial preparation out there. Did something I haven't done before, and that is working well in that dog. So if you've tried the others, I think a culture, which you have to do through your veterinarian, is probably where you need to start.
Okay, great advice. We've got another caller waiting to ask a question. We've got Santiago from Hayes. Go ahead with your question for our guest tonight.
Okay, my cat,
If you turn down your TV, then you won't get that feedback. You won't hear yourself talking.
Okay.
Okay? And then you can go ahead with your question when you're ready. Yep, go ahead. We are ready.
My cat has allergies.
Okay, do you have a question about the allergies?
Yes.
Okay. What would you like to know?
He got from the Humane Society, and he has a lot of allergies for some reason.
So you're wondering how you might treat those allergies?
Yes.
Okay.
Or what to give him from the vet.
Okay.
Well, there again, I think first thing to do is take them to your veterinarian and have an examine, get an exam on there and see if they can figure out what's going on. External parasites, fleas, maybe not this time of year, but that's one of the more common things we see with allergies. Sometimes we'll see food allergies, and then sometimes it's environmental. And so unless you know what you're dealing with, it's awful hard to treat.
Okay.
Maybe hard to treat anyway.
Yeah,
right?
it can be hard. Okay. Yep, you're right.
What might be some signs that your pet isn't feeling well?
Signs your pet's not feeling well. This goes into a little bit of husbandry as well, but not eating well, anorexia. One of the things that I tell my clients, I am a big proponent of a meal feeding plan for your animal, once or twice a day. I don't like food left out ad libitum, because sometimes you don't know for 2 or 3 days if your pet hasn't eaten. You just assume it's eating. And so I like to know. I tell people, my dogs, for example, my hunting dogs eat once a day. And so if I have my hunting dog doesn't eat in an evening, activity-wise they may be fine, but if they don't eat the next night, we've got a problem. If I feed in the morning, they don't eat, and they also don't feed that night if I'm a twice-a-day feeder. And the next day, if they don't eat in the morning, I would recommend you call your veterinarian. So I think the first thing is lack of appetite. Second thing would be loss of activity, laying around, having trouble breathing, abdominal effort when they breathe. Things like that would be the big ones I would look for. Obviously vomiting, diarrhea, things like that as well, but those would be the main ones I think I would look for in terms of a real severe problem.
Okay. All right. Our thanks goes out to Dr. Steve Mosier and Dr. Matt Nichols for being our guests tonight. Next time on Doctors on Call, our topic will be dermatology. You can email questions to us for our next program at the Smoky Hills Public Television website or directly to doctors@shptv.org by Tuesday at noon. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital. Experts, neighbors, friends.